Hello, today we are going to discuss a little about erythrocytosis and Polycythemia Rubra Vera. First, we will define what is erythrocytosis. Erythrocytosis is increase in the hemoglobin concentration of about above 18.5 gram per deciliter, or packed cell volume of greater than 0.52 in males, greater than 0.48 in females. It should be accompanied with no evidence of the secondary cause, which include chronic hypoxemia and drug causes. Erythrocytosis patient should be referred to a hematologist in case if you cannot find any other cause, for example chronic hypoxemia or drug causes. The referral should be urgent in two cases. The urgent referral should be done if the patient has developed the symptoms of increased viscosity or patient has polycythemia. Polycythemia means the patient has increased platelet count and increased neutrophil counts along with the increased hematocrit. So the patient should be given referred urgently to the hematologist in that case. Let's talk a little bit about Polycythemia Rubra Vera. Polycythemia Rubra Vera is a myeloproliferative disorder of the bone marrow stem cells, which results in the increase in the red cell volume and the overproduction. Along with that, mostly there is overproduction of the neutrophils, and in half of the patients platelets too, they also increase. In 95% of the patients with Polycythemia Rubra Vera, you found the JAK2 mutation. This new finding about increase in the incidence of the JAK2 mutation in the patient with Polycythemia Rubra Vera has changed the diagnostic criteria for the condition. In the patient with Polycythemia Rubra Vera, the following tests should be done. Number one, the patient should undergo, as I discussed earlier, JAK2 mutation. Number two, the patient should have a blood test done, complete blood count with blood film. This is to look for the patient has elevated hematocrit, as we already discussed, increased neutrophils, also increased platelets, increased basophil too. Then number three, the blood test for the LFTs and RFTs. Number four, the patient should have the ferritin checked, because if ferritin is low, it can lead to the mask the like polycythemia, or to be specific, erythrocytosis will be masked in the case of if the ferritin is low. Then there is another important test. Abdominal ultrasound should be done to look for any other than the renal causes of polycythemia. The important diagnostic criteria is the radiological evidence of the splenomegaly, which is present in these patients. Not all, but mostly. Then we always check for the erythropoietin level in these patients. Erythropoietin can be increased, can be low, can be normal. So patients with polycythemia with the low, all these patients can have a JAK negative mutation. If JAK negative mutation with elevated erythropoietin level, then external cause should be found other than bone marrow. For example, cerebellar hemangioma, for example, meningioma should be sorted out. If it is low, in the case of JAK2 mutation, mostly it is due to the bone marrow cause. So the patient might have the Polycythemia Rubra Vera even if the JAK is negative, but mostly in these cases, 95% cases JAK2 mutation is positive. But if it is negative, we should always consider with the low erythropoietin JAK negative mutation, we should also always consider checking the patient for exon 12 mutation in JAK2, which is found usually in these patients. If the patient has a normal erythropoietin and also with the normal erythropoietin patient has a JAK negative mutation, like JAK2 mutation is not found in these patients, then we should check for the red blood cell mass to look if it is a like pseudopolycythemia due to decreased plasma volume or no. There is a rare congenital mutation in the erythropoietin receptor. Erythropoietin receptor mutation that is congenital, that can be responsible for the polycythemia. Then, as we have already discussed, that Polycythemia Rubra Vera is a myeloproliferative disorder with 95% of cases having JAK2 mutation. Because of the abnormalities or abnormal proliferation of the bone marrow stem cells, leading to increase in the red cell volume, increased neutrophil count, and the platelets of the patients. This condition is mostly seen in the 60-year range. So after the middle age. What are the features in the patients with Polycythemia Rubra Vera? Number 1, increased viscosity of the blood. Number 2, the patient might have pruritus, especially after hot bath. Then number 3, patient has splenomegaly. Number 4, bleeding or hemorrhage because of the abnormal platelet function. Number 5 is plethoric appearance. Number 6 is 1/3 of the patients have increased blood pressure, hypertension. So these are the clinical features in the patients with the Polycythemia Rubra Vera. Then let's discuss further. As we have already discussed, first of all, complete blood count. Number 2, JAK2 mutation. Number 3, serum ferritin. Number 4, renal and liver function test should be done for the patient. In case if the patient is JAK2 negative and there is no secondary cause found like chronic hypoxia or drugs, then you should carry out further tests which include red cell mass to rule out the pseudopolycythemia. Number 2, arterial oxygen saturation, SpO2. Then ultrasonography abdomen, then erythropoietin in serum, already discussed. Number 5, the patient should be checked for bone marrow aspirate and trypsin, then cytogenetic analysis, and erythroid burst forming unit should be checked. Other features that are seen in case of Polycythemia Rubra Vera is low ESR because of polycythemia and raised alkaline phosphatase. Then let's go to the diagnostic criteria. Diagnostic criteria of the patient with Polycythemia Rubra Vera has been changed by the British Society for British Committee for the Standards in Hematology. Previously, it was done by Polycythemia Rubra Vera study group criteria, but now after the JAK2 mutation have been found, the criteria has been changed drastically. We categorize the patient with the JAK2 positive and JAK2 negative. So JAK2 positive patient, first we will discuss that both criteria should be present, A1 and A2. A1 is this one, JAK2 mutation positive honi chahiye. Number 2, the patient has increased hematocrit of greater than 0.52 in males and greater than 0.48 in females, and hematocrit other than that greater than 25% increase in the red cell mass. Both of these criteria should be present in the case the patient is JAK2 positive for the diagnosis of Polycythemia Rubra Vera. Then JAK2 negative. In the JAK2 negative, the first criteria is increased hematocrit. Here the hematocrit values are a little bit higher, greater than 0.60 in male and greater than 0.56 in females, and greater than 25% increase in the red cell mass. Number 2, this is A1, this is A2, is negative JAK2. Number 3 is no secondary cause for polycythemia. So first 3 criteria are mandatory. After that we should have either one of the A's or 2 of the B's. 2 more A's are, first is palpable spleen and the other one is genetic abnormality other than BCR-ABL, genetic abnormality. Then we go into the B criteria for the JAK2 negative mutation. B1 is the increased platelet count, then normal greater than 450 into 10 raised to power 9. B2 is increased neutrophils, that is greater than 10 into 10 raised to power 9 in non-smokers and greater than 12.5 into 10 raised to power 9 in smokers. Then a B3 is radiological, that is not palpable but radiological spleen. Then B4 is low erythropoietin or endogenous red cell colonies. So out of these, for the JAK2 negative, JAK2 negative, A1 plus A2 plus A3 plus either of A or 2 B's should be present to diagnose the Polycythemia Rubra Vera. Here it concludes our discussion regarding Polycythemia Rubra Vera. We shall come up with a new topic, and please subscribe and like if you like the lecture. Thank you.